Welcome to Perspectives. I'm Bob Lubzelder, and our guest today is Nichelle Blood. She's the Conneaut Health Commissioner. Hello, Nichelle.
Hi, how are you?
I'm doing okay. Hey, first of all, the stay-at-home order was supposed to end, well, the day this is being recorded, December 17th, but it's been extended till January 2nd. Can you explain? Right. So, can you explain what the stay-at-home order is?
So, the stay-at-home advisory recommendation was extended to January 2nd. We reevaluated this. Me and the county, the Asheville County Health Department and Asheville City Health Department all evaluated it to see if we should extend it or not. We are still seeing a huge increase of numbers throughout Asheville County, so we decided to keep the advisory in place until the beginning of the year.
So what does that mean? What does that entail?
So the stay-at-home health advisory that was issued by all the local health departments of Asheville County recommends that residents only leave home to go to work, school, or for essential needs such as seeking medical care, going to the grocery store, pharmacy, picking up food, or receiving deliveries.
How have people been behaving themselves or not in the Conneaut area? I noticed that Law Director Kyle Smith said that they were investigating some cases where people weren't doing what they were supposed to do. How are things overall?
I think things are good overall. We have seen a decline in our complaints of not wearing facial coverings or social distancing. We have seen a small decrease in those complaints. So I would say that we are doing better.
Well, I can remember like in April or so, you go into a store, maybe two people would have masks, and they all do now. Mm-hmm. Although sometimes they don't always have them up over their noses the way they're supposed to.
Mm-hmm.
So we've got vaccines. When is Asheville County going to get their first vaccines, and who are they going to be distributed to?
So we are working with our health and medical providers on the planning and implementation for the needs of COVID-19 vaccine clinics. These clinics depend on the amount of COVID-19 vaccine that each health department will receive over time. We will be anticipating on holding COVID-19 vaccine clinics throughout 2021 as the supply of COVID-19 vaccine becomes more plenishable. We are looking at getting some of the vaccine for this first round, hopefully around the 22nd or 23rd of December. That was put out by the state, and it's the first tier, first phase one, and it's mostly for, hold on, let me grab my list. It's mostly for healthcare providers and personnel, nursing home facilities, assisted living facilities, residents and staff of Ohio Veterans Homes, and EMS responders, and people with disabilities that live in group homes.
Okay, that would assume hospitals?
Yes. Yep.
Okay. When do you think that the average person would be able to get a vaccine? We haven't heard anything from the state yet when we'll be getting it for the general public. Because I've heard everything from late winter, early spring, early summer.
I mean, it's a good possibility. Yeah, I honestly, we're still waiting guidance from the state on when we'll be getting it for the general public.
Now, I read somewhere that there'd be distributions through like CVS and Walgreens. Mm-hmm. Is that, what do you know about that?
So they are actually, they are vaccine providers, but they're going to be helping the nursing homes and assisted living.
Okay.
So, that's not for the general public either.
Right.
They're going to be helping those individuals who have signed up with CVS or Walgreens to actually come in and vaccine their staff and their residents.
Okay. So are you ready to get the vaccine whenever? Are you any qualms about it at all?
No, I'm ready to get it whenever we do get it.
So also I understand that there are two vaccines. There's the Pfizer And then there's the Moderna.
Yep.
And they're similar, but the visor needs to be kept to like 94 degrees below zero, which may not be that difficult in northeastern Ohio in wintertime. But did you know which one we'd be getting here?
It looks like we're going to be getting the Moderna.
Okay. It's a little easier to handle.
Yes. Yep. For storage purposes, yes, it is.
So, getting back though to, I know that have been bars in different places in Ashtabula County, a dance hall in Austinburg that was closed down because they weren't following regulations. Is there anything like that in Conneaut? Are there places that just won't cooperate?
No, we've had really good cooperation with all of our businesses in town, and we've been working with them since the beginning on all of this, trying to make sure that they have all of the orders and rules and everything in place to help them through that process.
Now, you can still go to a restaurant in Ohio, correct? I mean, over the line, you cannot.
Yes, that is correct. Yep, our restaurants and bars are still open.
Now, so the bars have to close by 10?
Correct, yep.
And are you checking on restaurants still often, or?
Yep, our environmental health director is going out and still doing inspections.
And what kind of things do they look for?
Well, I mean, we do our normal inspections that we would be doing if we weren't in the middle of a pandemic, but then there are added measures on top of that just to make sure that they are following all the guidelines that have been put in place.
Okay, Nichelle Blood is our guest. She's the Conneaut Health Commissioner. And this is being broadcast the Sunday before Christmas. And I'm sure that lots of families want to get together, and, you have parties with his side and her side and all that kind of stuff. So what do you say about that this year?
So we are advising that residents limit their holiday celebrations to people that are just in their immediate households and to not risk gathering in other groups of people. We did see a little increase with Thanksgiving, and we did have a couple different instances where it was where they were gathering for Thanksgiving dinner, and most of the family members winded up with COVID.
Really? I was going to ask about that. So this isn't some kind of fake news kind of thing that some people say that this is all an illusion or something, that there are consequences to actions in this thing.
Yeah.
So what, maybe people should make a date to have their celebrations for Easter or something like that?
Well, I mean, everyone's holiday celebrations have been a little bit different this year with everything going on. I know with Thanksgiving, it was just me and my husband for Thanksgiving this year, which was kind of weird because we always usually go over to my grandparents and we have this big celebration. And we kind of do the same thing for Christmas, but we're not doing that this year. One of the things that me and my family are doing, we're going to have a Zoom conference and have a little celebration on Zoom.
Okay.
Just so that we're still able to see each other and still be able to celebrate, but just in a safer manner.
Okay, all right. Now, your husband had COVID, correct?
That's correct, yes, he did.
And he's okay now? He's back to work and all?
Yep, he's back working. He's doing good.
But you didn't get it. So what is he quarantined in one side of the house and you had the other side of the house? Or?
Yeah. I stayed in the living room for a week and a half or 2 weeks or whatever it was, and then he stayed in our bedroom, and I would cook him dinner and take it up to him, and he wouldn't come out.
Had he changed at all? Got a little older or whatever when you finally saw him? I would take it, though, that he probably followed the rules and the mask wearing and the 6 feet and the hand washing, that sort of thing. So it's kind of scary, though, because even if you follow all of that, right now, or at least at the recording, the state representative John Patterson has COVID, and he's in the hospital.
I did hear that.
He's in the hospital, and he says he followed all the rules.
Yeah, I mean, if you could, I mean, there's so many different ways that you could contract it at this point. We are seeing a large percent of community spread.
And I know today, as we're recording this, we've got some snow out there. It's a little cold, and so people will be staying inside. And so that's going to kind of exasperate the whole thing, isn't it?
Honestly, I'm not sure. I mean, I could see it, but as long as we're staying apart from each other as much as we possibly can, we might not have a spike. I mean, it just depends.
How long do you think before the vaccine takes effect and we see fewer cases?
I think it will be a little while for us to get enough people vaccinated in order to see a decline.
So there's no sigh of relief yet?
Not yet, but there is light at the end of the tunnel. We're getting there. We just we're in for it for a little bit longer.
I had a discussion with my grandchildren yesterday about this, and one of them, Marcus 9, says he doesn't want it because it hurts. So, does it hurt? You haven't had it yet, but...
No. Well, some of the side effects that they are saying that you could possibly see is that you could see fatigue, headache, soreness or redness around the injection site, and then muscle or joint pain.
Okay, and then...
Those are some of the side effects that they have put out so far.
And you need 2 doses?
Correct, yep.
Okay. Another thing, you've been working with the Ashtabula City and the county health departments, and there have been some statements by some health officials that when you're exposed to COVID, you quarantine for, it used to be 10 days. You don't really have to do 10 days. 7 days is sufficient. But you guys had kind of a statement saying that you suggest 14 days no matter what. So can you talk about that and what conclusion, why you got that conclusion?
Yeah, CDC and ODH, they did put out recommendations for changing the quarantine dates. It was just recommendations. The thing with COVID, this virus, the virus itself has not changed. So you could still show symptoms on day 14 with being in quarantine. So we decided as a county that we were going to stick with the 14-day quarantine.
Okay. And some people don't. They test positive for the disease, but they have no symptoms, but they could pass it on. Is that?
That's correct. Yep, they're asymptomatic carriers of it.
So when you're with a bunch of people and you don't really care if you get it because you don't think it's really a thing, but you could go visit your grandparents then and give it to them, and that could be deadly. Correct? Correct.
Yep.
So, Nichelle Blood's our guest on Perspectives today. And we talked about this before, but when you took over this position, do you have any idea? I know that President Obama had a playbook in case something like this happened. Was this something that all health officials were thinking in the back of their minds, this might happen?
I mean, we always... we have plans for almost everything, but I honestly, I thought that this would not happen my first year as health commissioner. I thought maybe at least a couple years in, get myself, ready for it, but I'm happy that I am here, and I'm happy that I am part of this department, and we are working hard, trying to make sure that our community is safe.
So from a philosophical standpoint, if you hadn't become health commissioner, none of this would have happened around the world.
No,
All right, well, have a nice, quiet Christmas, Nichelle, and thank you for being with us on Perspectives today.
Thank you.
All right, I'm Bob Lebzelder.